1st at 4:45 p.m. First on the agenda is the review of minutes.
Make a motion for approval.
I'll second.
Have a motion. Discussion. All in favor, say aye. All opposed? Motion carries. All right, at this time, on the agenda, it has conflict of interest of any board member. So at this time, if there's any conflict of interest regarding any agenda items, right now is the time to speak. Hearing none, I'm going to move on. This is the public comment section for the agenda items. If you would like to speak on any of the agenda items today for the Finance Committee, you to speak now and say your name first. Hearing none, we're going to move on. I also want to remind everybody on the phone to please mute your phone device or having presentations today. All right, so we're going to move into the financial report for the month ended October 3rd.
Good afternoon. Okay, so we are reporting on October, which is the first month of our new fiscal year. So when we look at the various slides, we're not going to talk about year to date because it's the same as month. And annualized will be for the 12 months ending October, so there'll be a little bit of a change. But when we look at our admissions for the month, we came in at 1,105 admissions. This is down from prior year of 1197 and a budget of 1171. I think what you're going to find interesting is that in this new budget year that we had, we tried to estimate where we thought our top line statistics would be. And we basically tried to be anywhere from 90 to 93% of prior year in the first 6 months of this new fiscal year compared to 2019. What you see here, though, is that we're still 5% less than our budgeted number. So our volumes are trending even less than what we had anticipated them being down. And you look here, even though they're better, I mean 1,105 compared to 1,000 compared to in May of 945. We're still not where we thought we would be budget-wise, budgeting a 10 or a 5% decline in these numbers. So now we still had I'll jump ahead to all the, we still had a good month, but it's just interesting that we were unable to get to our budgeted numbers, even with a reduced level of budget. So adjusted admissions, we're down 8% to budget. Average daily census, this is one of the few that's up to budget, 179.9 compared to 175. And this is simply a function of the length of stay. We continue to see length of stays longer than anticipated, and this is mainly due to the COVID that we're encountering. Deliveries, we're right. I mean, we're just 2 deliveries ahead of budget, but the same with last year. This is the only number that we really got close to as far as estimates. Surgery cases, again, we're off 2.8% to budget, 16% to this time last year. And if you look down here at the numbers, we still had a decent month, but it isn't where we wanted to be budget-wise. 787. You can see the increase slowly increasing up. You can see it in the picture too, that surgery continues to go up. Now November will be a slight decline simply because we had to pause again because of the surge we see. This is by far the closest one. Graphically, you can see we did on ER visits. I mean, we knew we were going to be down in ER visits and we budgeted down significantly, but we're still 6% off of where we thought we would be budget-wise. Okay. Okay. So here again, we can see all of our outpatient occasions of service, 21,702, 6% off from budget, 18% off from prior year. And I mean, it's a slight increase from where we were. But overall, all of our top line stats are down. This is another one that's up, but look at how far it's declined versus the budget. So yes, we've had a nice increase in our urgent care visits. We're still not where we'd like to be this time last year in urgent care. Pro care office visits, we're significantly off of budget and prior year. So you look at all that, and then you look at where we are staffing wise. You would think we would be down less in our blended FTEs. We are less than budget, but we're only 0.5% off. And versus prior year, we're 8.7% off, about 175 FTEs. But when we look at paid hours per adjusted patient day, remembering that our adjusted patient days are going to be higher because our length of stay is higher, our paid hours per adjusted day is a lot lower level than what we had budgeted and what we had tracked on an annualized basis. So we were able to efficiently use our FTEs, even though we're only 10 below budget. On receivables, we had a good month. You can see some of the efforts of our conversations with RevWorks R1, collected $22.8 million for the month. It's the first $20 million plus we've had in several months, which is good. Our AR, though, has only come down slightly, but again, they continue to work it. We are seeing a decline in that. Our revenues, and this is where it was surprising, and Grant and I were looking at this, we're at $112 million worth of gross patient billings for the month. Slightly off of prior year, and a budget, we're actually ahead of budget. And the question is, how can we have more patient revenues when our volumes are off so much? Well, within this number right here is about $4 to $4.5 million worth of catch-up billings we had in ProCare. As we continue to dig into ensuring that we're getting all the billing out, Brian and his group were able to find where we were behind, and the coding team were able to get it done. So we're a good $5 million in catch-up monies here, which is what's distorting that number. It's still a good thing, but it makes for a question when you first look at it. That also translates into a little bit better net patient revenues. Other revenue is right on target with where we had budgeted. It is down from prior year, which we would anticipate. Operating expenses are slightly ahead of budget, and this is not so much the salary and wages, but the level of contract labor that we've had to incur just because of the COVID and getting people in here to help work. Benefits are right in line with budget, down from prior year. Supply expense is right in line with where we should be. Purchase services are a slight increase. I think this is a timing. It's not a trend. Total operating expenses is $200,000 higher than our budget, but you can see significantly below prior year. So all this translates into an operating EBITDA or an operating cash flow of $1.7 million, which is better than budget. And if you recall, prior year was overstated. So better than budget, better than prior year. And when we look back here over the last several months, you can see we're positive. We're slightly off here in July. This was a catch up from these 2 months. So the last several months, we've had a very nice positive operating EBITDA, which is good to report. If you would have asked me back in the April-May time period, if we hadn't done all the things that we had to do then, where we would have been, I would have projected these were significantly larger as far as losses. So we're weathering the storm, not to the extent I'd like to see us, but obviously better than budget. Today's cash on hand still is hovering around the 103-day mark, and it excludes, remember, the monies we have set aside at Frost Bank for the Medicare advance payments that we'll pay back starting in August of next year. Madam Chairman, that is all I have to report.
Anybody have any questions for Mr. Ewing? Not, I'll entertain a motion.
Make a motion for approval.
Second.
Have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. I do want to say that Dr. Davenport's on the phone participating, so make sure that was noted. All right, we're going to move into our consent agenda. Now we'll entertain a motion for the consent agenda.
Make a motion for approval.
Second.
Have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. Okay, we're going to move into consider approval of an engagement letter with Weaver. Mr. Ewing.
Okay. Earlier this month, we met the audit committee, and we had presented there the engagement letter from Weaver, which does our internal audit work for us. They're the internal audit firm. BKD is our external audit firm. Weaver presented their plan for this upcoming year, in which they'll be looking at various aspects of the finance department, namely vendor management, balance sheet reconciliations, and various security protocols that we need to have in place. The internal audit process is meant to bolster the overall financial integrity of the organization so that when BKD comes in for their external audit, we can show to them that we have an outside firm that is continually looking at our finance processes on a rotating basis, various special topics. With that, we had a budget of $192,000 for the upcoming year, and it was detailed within the audit committee. I put that forth for consideration.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. All right, and Mr. Collins, we're going to consider approval. I'm going to let you say that. What are best service agreement?
Shimatsu.
Shimatsu.
So I'm sure many of you have seen the portable X-ray machines that we use in the hospital. They kind of push around and they have a grab handle that goes from room to room. There's a component of those machines called a detector unit. That's what goes out under the bed between the patient and the portable X-ray sensor. And these receive a lot of use, and occasionally they're dropped or bumped and they become inoperable. And unfortunately, they're about $50,000 each when they go bad. So we worked out this agreement with Shimatsu, where essentially they're going to put a rider on these for a $5,000 deductible. It's the detectors. We have two that are damaged right now, so they're awaiting approval of this agreement. If approved, we'll automatically have one replaced. This is a 2-year agreement, $47,600 each, and 6 detectors for those.
Bargain. How many do we have total?
Portables. There are 8 plus 7 in the bar. Request approval for this.
All right, I'll entertain a motion.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. All right, and then we'll move into your next one, Mr. Collins.
Okay, this is a request for an emergency capital purchase. This is for our tube system. All of you have been to a bank or Costco or whatever, you put that vessel in the pneumatic tube and it transports whatever in the vessel to its location. So we literally have thousands of feet of this tubing system that goes through the hospital. And there's multiple control units where they go into a rack and then they switch tubes and they're routed throughout the hospital to the correct location. System is about 10 years old and it goes up and down and up and down and requires constant resets and maintenance. Unfortunately, this is extremely disruptive to the hospital because everyone depends on this thing to be up 24/7. It transports medications, lab samples, important orders and paperwork. So management's recommending at this time that we do a modernization on the system and upgrade it with some hardware, software, and other controllers. Total cost of the project is $166,090. That includes $5,000 for cabling and a $10,000 contingency in case of any problems. This will come out of contingency capital.
Do we need to vote on all these, or can we vote?
Yeah, we will probably
Let's
just
have
vote
one more.
every one of them.
Yeah, I think we have to vote on each one. Is there a warrant? So they're gonna come in and redo this system. You're gonna have it upgraded. Is there a warranty for their work that they're coming in?
There is,
There is something to cover
There is.
if something happens.
People don't understand that each individual force, I've said that we have almost 2,000 individual force calls. So the multiplier of that, with each individual.
Got 'em?
Power of the mute all button.
Okay, he probably unmuted himself. All right, so I'll entertain a motion for this capital expenditure request.
Make a motion for approval.
I'll second.
I have a motion, a second. Any discussion or questions? All in favor say aye.
Aye.
All opposed? Motion carries. All right, and you've got one more, Mr. Collins.
This will be the third and final. This is for an expansion of our BD Pyxis medication management system. What this CDR does is allows us to outfit all anesthetizing locations with an anesthesia medication management system. It does a couple of things. It puts all the medications in the room where the procedure is taking place, so there is no more running back and forth for meds that you may or may not have in the room. And one of the things, it provides us a system where we can track and monitor use of controlled substances and do a better job of preventing diversion if there is anything. The system tracks every med that goes into the cabinet, every med that comes out and is administered, and every med that is wasted. And all of that is documented, and then there's some algorithms in the software that can detect inconsistencies. This has been through all the medical staff committees. Physicians are fully in support of this. In addition, I need to mention this was a finding in our DMV survey that we needed to do some system modifications to be compliant for med management in those areas. Total cost is $376,463, and that outfits all of our rooms.
Any questions about this? Not, I'll entertain a motion.
Make a motion for approval.
I'll second.
A motion and a second. All in favor say aye. Aye. All opposed? Motion carries.
Thank you.
Madam Chairman, we're going to go through several of these, and this is simply because we don't have a 2021 approved capital budget. We're still working on the long term. So these are going to be more of the emergency type or things that just can't wait.
Okay.
And that's why we're having to go through each one of them individually.
All right, so we're going to move on to consider approval of emergency purchase workstations on wheels.
Yeah, so the first one we have is what we call our WOWs, and those are devices with the computer, a scanner, a printer, and then they have lock drawers for the medications. The nurses and RTs use those in all the rooms. in order to deliver the medications and scan them and print our labels for labs and things like that. As we have found COVID and the expansion to various units that we don't typically use for patient care, we needed to purchase 15 more of those carts with the 15 computers, labels, and printers to go on top of those. It totaled a cost of $78,691. So I'm seeking approval or ratification for that approval that we did for that purchase.
Any questions? I'll entertain a motion.
Make a motion for approval?
And any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. Okay, can you move to your next one?
So the next one that I have is the Versapulse Power Suite 60-watt laser. This is really to focus on our 5 urologists. We've been doing a lot of work with Steve in regards to the equipment that we're using, the rental versus the purchase of, and looking at where we can expand our service lines. So this is a laser used for the lithotripsy, your kidney stones, bladder stones, those kinds of things. Currently, we rent a laser from Agilital Surgical for $3,600 a week. So we want to have a cost savings there to go ahead and purchase this laser for $87,900, which is a cost savings when you look at the $3,600 a week that we use currently. And then to support the 5 urologists to really help push that service line to bring a little bit more business here with the high-tech equipment that they'll have.
What was the cost?
$87,900.
What's the lifespan on one of these?
That is a good question. I really don't know.
I would say at least 5 years.
Well, we make things last like double.
Yes.
So,
So,
you
it'll
know,
probably be more than that.
It says 10 years on the,
I'm sure it'll go on the depreciation schedule at 5 years.
Oh, on the actual paper.
yeah, it says
paperwork.
10 years.
All right, I'll entertain a motion.
Make a motion for approval?
I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. All right, and then you have a striker.
So the next one I have is a Stryker TPX small bone drills. This is the second step of our power upgrade for all of our drills and saws that we use for the ortho neuro groups that we have. This is the lightweight group for multiple specialties, used upwards of 200-300 times a year. We really reprocess and use these multiple times a day. We did the large bone in our last purchase request. So this will cover all of that under the same use of Stryker that we did for the large bone at $463,380.96.
They wouldn't round it off, take the 96
I know, round it up, round it down.
All right, any questions about this one? All right, I'll entertain a motion.
Make a motion for approval?
A second.
I have a motion and a second. Any discussion? All in favor say aye. Aye. All opposed? Motion carries.
And the last one that I have really ties into the robotic instrumentation that you just did last month. This is a BK5000 ultrasound system that we really use in robotic surgeries to ensure adequate excision of cancerous tumors, tissues, those types of things. It really kind of helps with our specimens and reducing those numbers of frozen sections for immediate pathology review. This is going to be a cost of $145,776.89. We do not own an ultrasound that has the current capabilities for the visualization and use with our robot now. So this will actually be something that will be new for our facility. The BK Medical, we chose them. They are a preferred vendor for this type of ultrasound. There's an additional $21,108 expenditure, but it will go into operations so that we can work through the equipment, service agreements, and things like that. So that is not included in this price, and we'll put it in the operational budget. Questions on that one? I'll entertain a motion on this one.
Make a motion for approval?
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. Thank you. All right, we're going to move on to the Cisco fiber channel switch replacement. Carpenter.
Tonight I'm asking for approval for, the first one is for replacement of our fiber channel switches from Cisco. These switches are what allow our communication between our servers that do all of the processing to our storage appliances that we purchased last year. The current switches are end of life, end of service as of October, so we can no longer patch them for security. They are out of maintenance, so we really need to get those replaced to continue to have that communication between our storage and our servers. That's the first one.
Okay, let's go ahead and vote on that one. Does anybody have any questions about that one?
How much is it?
That one is $68,539.
Even, say, 0, 0.
0.
We rounded down.
On the next one.
So you said this one expired in October, so what is the last bet on this? So we're approving this, how long is this gonna last?
So both of these that I'm presenting tonight have limited lifetime warranties, but 5-year full warranties on them.
Your current switch, how long have you had it?
The current ones, oh my gosh, I believe we've had those since, I think it was 2017, the last time we did anything with them. No, it has to be longer than that, from 2015.
So about 5 years.
Yeah.
Okay. All right, I'll entertain a motion.
Make a motion for approval.
Second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. All right.
Okay, the second one that I have are, is replacement of 54 Ethernet switches. These switches are used throughout both our main facility and all of our other facilities, and it's what allows every device to connect back to our main computer room. So these are basically hubs and closets, if you will, and that's what allows everything to connect. Our current ones were end of life, end of service between 2016 and 2018. So we've gotten all the goodie we can out of these. We can no longer patch them. We can no longer get maintenance on them. So I'm requesting $289,330.69 to replace all of those switches and to secure our network.
So this is a connection back to the mothership?
Yes, sir, it is.
Will it speed it up any? Will we see?
This one actually will. This one should provide us a little bit faster functionality. And I failed to mention that on the previous one, it should also help retrieve storage and information back from storage. So both of these should help with performance as well.
So this approval is going to replace all of them.
It will, and we'll have to do them in a rolling fashion so that we're not knocking out a whole floor or a whole clinic at a time.
When do y'all plan on starting them?
As soon as we can get our hands on it.
Okay.
Did you say there's 54 of those?
There are 54 of them, yes, sir. And I have a nice little tiny diagram if you'd like to see it.
All right. Any questions for Linda? Okay, if not, I'll entertain a motion.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion?
I'd like to point out that one of the things that Linda has discussed with Russell and I is the fact that these right here are also an increase in the level of security to our network, just given the amount of malware that's out there. She has put this forth as a way of trying to secure our network even more than what it is. We've also asked her to come back to the board at some point here in the near future with a revised operating budget, just given the heightened level of security we need to have. So these are some of the first steps she's having to do in trying to provide even more security. We've got lots, but it only takes one person finding a way into our system and it can pull everything up.
This is mostly the hardware components of it. There's a lot of software components that we'll need to look at as well.
Okay. Thank you for clarifying that. All right. All in favor say aye.
Aye.
All opposed? Motion carries. Thank you. Thanks, Linda. And with that, we are adjourned.